Preventing infections. You can take many measures to prevent infections from occurring in the first place.
Wash your hands as often as needed and maintain proper body hygiene. Use a cotton mask to cover the child's mouth and nose.
Avoid crowds. Avoid people with colds, flu, boils, loose motions, or skin rashes. Avoid children who have been vaccinated in the past 4 weeks, especially if they have received polio drops. Never give polio drops to the child or child's siblings. Hand hygiene. Simply washing hands in the correct way can prevent many cross-infections from occurring.
The child and parents must always wash their hands with antiseptic soap before every meal, after using the toilet, and when returning home from outdoors. If you do not have access to water and soap, you can use antibacterial hand rub to disinfect your hands.
Keep the child's and your own nails short and clean. No nail polish should be used. Body hygiene and skincare. Skin and body care is also very important to prevent infections. Bathe twice a day. Wear clean cotton clothes. Change soiled clothes frequently. Clean the child's nose by blowing it gently into a soft tissue paper. Use lotion or oil to soften and heal the child's skin if it becomes dry and cracked. Bring any cuts to the doctor's notice. Clean any cuts right away with warm water, soap, and an antiseptic as recommended by doctor. Before the normal bath, the child must take a sitz bath.
This prevents infection in the area around the anus.
If the child is suffering from loose motions, there are some extra precautions you must take. Take a sitz bath 2 to 3 times a day. Change clothes if they are soiled.
Do not rub the area around the anus, otherwise the skin will ulcerate and become painful.
Allow the area to dry and then apply zinc ointment. Make the child wear cotton diapers. Wash your own hands with soap and water after you have helped the child in the toilet. Hair. Make sure to keep your child's hair clean. If the child's hair is falling, go to the barber to trim or shave the hair off completely. This must only be done if blood counts are normal.
Ensure that the barber uses an electric shaver and not a traditional razor. The child can wear a freshly cleaned cap or scarf while going out. It is important that the cap or scarf is washed regularly, as it may harbor germs which can lead to an infection. The child does not need to wear a cap or scarf inside the home.
Dental hygiene. The child's teeth should be brushed twice a day, once before breakfast and once after dinner. If platelet counts are normal, then the brushing should be done with a soft bristle toothbrush and toothpaste. If the counts are low, brushing should be done with the child's finger to avoid bleeding. If the child is more than 3 years of age, they should also gargle with chlorhexidine mouthwash, a minimum of 3 to 4 times a day, especially after every meal and before bedtime. This helps to prevent mouth ulcers and infections. While preparing the mouthwash, mix equal amounts of clean drinking water and mouthwash. The child must hold the solution in the mouth and gargle for 30 seconds and then spit it out. The child must not eat or drink anything for half an hour after the mouthwash. However, if the child is below 3 years of age, apply some candid mouth paint inside the child's mouth 4 times a day after food and at bedtime. The caretaker should wash his or her hands with soap and wash the child's mouth with water that has been boiled. Then, the caretaker should apply the paint directly in the child's mouth. To make the paint more effective, the child must not eat or drink anything for half an hour after the paint is applied. Additionally, for children older than 3 years, a clotrimazole tablet should be slowly dissolved in the child's mouth or chewed by the child thrice a day to prevent fungal infections. Lung health. To prevent lung infections, avoid taking the child to crowded, dusty areas and construction sites.
Make the child do steam inhalation twice a day. The child must also do 10 repetitions of the following exercises.
Deep breathing exercises. Pranayam. Ask the child to take a deep breath, hold it for some time, and then breathe out slowly and relax. Spirometry or bladder balloon exercise. The child should blow the spirometer or bladder balloon to its maximum capacity and hold for some time.
These exercises must be performed in the morning, at noon, in the evening, and at night.
Vaccines. Do not give the child or the child's siblings any vaccinations during the treatment period without consulting the doctor. Playing. While playing and being active is very important for the child during treatment, take the following precautions to ensure that the child remains safe.
Encourage the child to wear a face mask when outside the home to prevent infection.
Wear a mask when visiting the OPD or other crowded places. Change the mask twice a day with a clean, washed mask. To minimize the risk of injury or bleeding, make sure the child plays with safe toys and does not put any sharp or small objects into their nose or ears. Also, avoid sports and other activities that might result in injury.
Do not allow the child to play with any stuffed, furry or dirty toys, flowers and plants, and pets, as these may carry germs that cause allergies and infection.
Clean living space. Bedroom, bathroom. Keep the living area dry and clean because moisture and humidity attract bacterial growth. Store luggage properly in the cupboard. Keep the child's bed clean and tidy. Change the bed sheets frequently. Do not keep damp clothes in the children's room. Floors should be swept and mopped twice a day with a phenyl solution. Use nets on the doors and windows to prevent flies and mosquitoes from coming inside. Toilets and bathrooms should be cleaned daily with Dettol or Savlon. The WC should be flushed properly before and after every use. The bedpan and urinal used for the child should be cleaned and washed daily with a hypochlorite solution or Dettol solution. Discard waste products such as urine and vomitus immediately. They should not be kept lying under the patient's bed. Clean living space. Kitchen. Dispose of garbage and waste materials properly. Keep all foodstuffs covered. Wash and dry utensils properly. Parents' hygiene. It is extremely important for the parents and other people around the child to be hygienic. They should take a proper bath and wear clean clothes. Hair must be tied up properly. Nails must be cut and kept short and clean and without any nail polish. Hands should be washed properly with antiseptic soap after going to the toilet and before coming near the child or serving food. Smoking should not be allowed anywhere near the child. In case the parents are not well, they should wear face masks and try to stay away from the child. Hospital visitors. Limiting the number of visitors is very important. This is because visitors can be a major source of infection. Only the caretakers should be around the child. Only 1 or 2 visitors are allowed to be with the child. Instruct visitors to remove their footwear outside the ward. Visitors must not touch the child without using hand rub. Visitors must not sit on the child's bed or go very near the child. If a relative is suffering from an upper respiratory infection, tuberculosis or other infection such as cold, cough, fever, loose motions, measles, chickenpox or any other kind of skin infections, do not allow them to visit the child. Visitors who have recently taken oral polio vaccine, measles, mumps, rubella, MMR or any other vaccine should not be allowed to come in contact with the child.
Lastly, no small children or infants are allowed to come to the hospital.